they like to incorporate into.
Reaction to the first shot.
Hey, Sue, how are you?
I wonder if she had COVID. She said, well, the last
Hey, everybody, we'll just get going in a few minutes here. Let's wait for a few more people to log on.
Hey, everyone. Just wanted to thank you again for logging on tonight. So tonight we're going to do some discussion on and some modeling of how we do bracing and splinting. So feel free to ask questions. I think we'll probably, open it up after we do some of the splinting and bracing for any questions that folks may have. But we appreciate you all joining us. This is our last demo, if you will, class. So we will be we're looking forward to having all of you do an in-person job shadow, and we'll be sending those dates out soon, so that you guys can get signed up for an in-person job shadow. So I'll turn it over to Linda. This is Linda, one of our OTs here, and she's just going to talk about some of the braces. And I think someone else is going to maybe play with the brace with you.
I'm going to talk to you about ACL ligament braces, or actually ligament braces. We have a tendency to call them ACL braces all the time because most people that are worried are people that have had an injury to their ACL or had surgery on the ACL. Some of you, if you play sports, if you ski, if you have brothers, sisters, or parents that play sports, you might know these kind of braces. So a ligament brace is a brace that you'll get if you have an injury to your ACL, your anterior cruciate ligament, your MCL, your PCL. Oftentimes, sometimes they might even put a meniscus in a ligament brace, but not very often. So you might have seen braces that look similar to this. There are several different styles, several different companies that wear them. Doctor will put you in this brace if you had an ACL surgery, usually anywhere from 6 to 9 months after your injury. You're going to wear this when they first tell you that you can start walking on uneven ground. You're not going back to your sports. You're not going back to skiing. You're walking on uneven ground. I'm a registered orthotech. I'm also a certified orthopedic brace technician. So What we do for measurements with these braces, and some of them are very simple. These are what we call semi-custom off-the-shelf braces. We generally take 5 measurements. We take a measurement 6 inches above the knee, 6 inches below. We take a knee circumference. We take a measurement below your patella. And oftentimes we might take what's called a gauge measurement with this little machine right here, depending on what brace we're getting. Every brace has different qualifications of what they want you to do in order for measurements. They are lightweight for the most part. This brace here, we like to use on people because it has a short cuff, and if someone skis, they can fit it with a ski boot. If you were someone that was, say, a wide receiver on a football team, girl playing lacrosse, playing field hockey, we would use this brace. It's lightweight, aluminum grade, airplane aluminum, so we would use this brace on you. Made by a company called Donjoy, DJO. This is a brace that we use often. If you were a football player, probably a big linebacker, it's made of, heavy metal. So we would use this for you. It's a much more sturdier brace on you. So there are different braces that we use for different people's activities. There are even some braces that have dual purposes. This brace here is a ligament brace, but by doing a couple of little things, you see that brace just kind of wedged out. This brace can also have people that are older that have now osteoarthritis, and they need to have a brace that can open up their joint space on their knee. So it will help them in ligament wise, but it will also help them for osteoarthritis. To do bracing, again, we take 6 measurements for a semi-custom. Custom braces are a little bit different. A custom brace is a brace that, we might, and I'd say 8-10 years ago, we used to take a cast molding of your leg, and then we would send it on off to the brace shop or the company that was making the brace, and that would do how they would make your brace for you. Now we use things as easy as an iPad, where we'll just sit and we have a grid, we line it up with your knee, we take pictures, we take certain measurements, then we just, send that off through the iPad to the company. Very easy, very quick, and very efficient. You get a color if you get a custom, but custom braces are not something that's often approved because these braces are that good that you don't necessarily have to have a custom. If you had some kind of a leg deformity that, we might need to have to get you a custom, but really is ever a custom brace ever necessary? I don't know if you have any questions about ligament braces. It's part of your job that you could do if you're in the orthotech program. In order to do these braces, you have to have a couple of years of experience of fitting them to become certified, but it's a great thing to have. A lot of certification registration when we're billing is needed in order to get these braces paid for. So it's not just, having the schooling and having the degree, it's also getting your registration or your certification. It's a big help to the company if you don't have it. Sometimes we can't bill out these braces or get paid properly for them, and they are fairly expensive. I don't know if you have any questions or not.
So we'll just give you a few seconds if you want to access the chat, if you have a question or two about these ligament braces. Jocelyn, we see your dog. Don't worry about it. It's fine.
Oh, where? I'm always good for a dog.
Okay, a question is, how much does one of these braces cost?
So the bill out cost for one of these braces is $800. It's not necessarily what you might get paid for it, but its bill out cost is $800. So they are very, they're fairly expensive. If you were to get a custom brace, the bill out cost for that is $1,500. So there's a, a good discrepancy between the two prices.
Are all 3 the same price?
All these 3 braces, yeah, they bill out at a certain code. So everybody says, what about these braces? The braces, you can have different companies. You can have 10 different companies, 10 different ACL or ligament braces. Their billing code is all the same. It's a code called L1845. Not that you really probably care about that, but the code is all the same for all ACL braces. So they all bill out the same. It doesn't matter that, you know, this brace might have cost us $500 or $600 and the other one $300. Everything bills out at the same cost, $800.
All right, if there are no more questions, oh, here we go, maybe. Is ACL the most common?
I would say yes, ACL is one of the most common braces that you do. You don't see very many PCL injuries. That's not too often a common injury. MCL injuries are usually a sprain, so they might not go this, you know, much with a brace. ACL injuries are something that are very common. You see a lot of girls, young girls, high school girls with ACL injuries. You know, so a lot of people might think that, oh, it's only the guys that are getting these braces, but it's not. At your age level, younger, we see a lot of female athletes and or dancers or gymnasts that have these injuries.
All right, if there are no more questions on these braces, you want to maybe move to the next set of braces? And
Yeah.
Linda, actually, well, wait 1 second, Linda. Usually, how long would someone have to wear a brace like this?
So that is determined up to your doctor. In most cases, somebody might wear this brace. You're only going to wear this brace for certain activities. You're not going to have to necessarily wear it for everyday living. So say you're a skier and you have torn your ACL and now you've had your surgery, you're recovering from it. You're probably going to wear an ACL brace probably for the rest of your life while you're skiing. The ACL brace helps with the torquing. So with those double hinges, it's helping your knee so you don't torque. No brace can prevent you from re-injuring your knee, but it's there to help you re-injuring your knee. So that's going to help with that torquing. So if you're going to ski for the rest of your life, you're probably going to wear the brace for your rest of your life. I've had people come in and they've had the same brace for 15, 20 years. Now they've decided they wanted a new brace that they've been wearing. You know, they might be in their 40s or 50s and their injury was in high school or in college. So you'll probably wear that, you know, for your activities. Your activities, anytime that you could really torque your knee, possibly injure it, you're going to wear your brace.
All right, last call for questions for Linda. I think she needs to get running. She's got a shrimp dinner at home. Wait.
No, didn't get the shrimp dinner.
If there are no more
Ask
questions
her.
right now, we can maybe ask her and send it to you guys as a response if you have one later. So thank you, Linda, for that. And who do we have coming up next?
Sling.
All right, we have Kelsey coming up to show you some slings or face. No, you'll be.
Hi guys, so I'm here to show you a sling. Let me, if I can get out of the package, just put lotion on my hands. Sandra's gonna help me. Thanks. So many of you might have seen a sling before. It looks like this. They do come in all sorts of sizes. Here we have, they usually come in like child size, what we call just like a regular adult that pretty much should, is pretty universal. And then we carry some that are just extra large for, you know, those big tall guys there. And it can be used on either arm. And we would use this here for like shoulder sprains, strains. We use it a lot for clavicle fractures, which is up here, or maybe some radial head, radial neck fractures. And sometimes we even use them on kids if they're in a long arm cast. Remember that cast we showed you that goes from here, incorporates the hand all through there. And we would use a sling if, you know, when they're going to school, if they're busy with their friends and they don't want to bump their cast. It's more of like a protection. And I'll show you how we put that on. So we're gonna have you go ahead, slide your arm in there. It does come with a little loop. I don't know if you guys can see it. Slide your thumb there. So by her sliding her thumb in here, it's allowing her, once we have it on properly, she can be able to rest her arm nice, and that'll take the weight of that. Just gonna have you hold that. And with the sling, you really want them to be measured nicely at about 90 degrees, kind of right below the breast area there.
There you go.
And always make sure to tell them to slide their elbow all the way back. So make sure your elbow's all the way nice and back. It looks good. Go around their neck there. And then you want to slide this strap through the D-ring here and tug it up comfortably to them. Everyone's a little different. So like I said, you want to make sure you have this at a nice 90-degree angle. And I'll Velcro that right around there for her. And you see now that she's totally relaxed that this is clipped and her hand is resting nicely and supportive of that thumb area. Any questions? I can't read from there.
I'll let you know if there are any. So yeah, if you have some questions, we can answer them for you. Just throw them in the chat.
Yeah, we can always go back.
Yeah.
We can always go back to if you,
Think of something on any of them.
yeah, if you're a little gun shy right now, which is fine. So we'll move on to maybe the next brace, which is, looks like a boot of some sort. And we'll have Steph come on in and to show you that.
You might have to bring.
We can bring it down. Okay. Yeah, oh.
All right, hi guys. So this is one of the boots that we put on a lot of our patients, probably the most popular boot that we use here. So boots can be used for quite a few things. So sometimes if it's a more minor fibula fracture, we can put them in this rather than casting them because of the stability, and you can walk on your so a fibula is a non-weight bearing bone. So you can fracture that and still be able to walk on it. So this would be a better option for that versus a cast. Or after they've come out of a cast, this is the next step down from that. Or really, really bad sprains that a lot of our other braces just aren't supportive enough for. But again, where they wouldn't need a cast. So, yes, thank you. All right, so there's a lot of Velcro.
Just bring it up a little bit so we can, it's a little hard to see in your shirt.
Oh, yeah, I chose the wrong color. So once this is un-Velcroed, there's a lot of extra padding inside. So if they need extra cushion somewhere, they can put this anywhere that they would need to in the boot. And then when you open it up, it looks like this. So we put the patient's foot in, we tell them to make sure that their foot goes as far down and as far back as they can get it. Because you don't want your foot too far forward. And then we Velcro them in. And then a lot of the times I would put one of these pads right across her ankle here. I don't know if you can see, but there's a little opening there. And sometimes one of the straps will rub there. So what we'll do is just kind of tuck one of these pads in and then just Velcro it up. And then on the sides here, there's two like little struts. So you want these generally lined up right on the side of their leg. You don't want them too far back or too far forward. And then you just Velcro all the straps in. And we always tell the patients, you want them nice and snug so that the boot's giving you the support that that you need, but not so tight that it's causing more pain or discomfort. And then depending on their injury, we might tell them to not weight bear on it for a little while. Or if they're coming out of the cast, usually we'll let them know that they can weight bear. That's all up to the doctor's discretion. And the bottom of the boot is a rocker bottom. So we just tell people to be mindful when they're walking, start with their heel and roll through to their toes. That way it's a little easier for them to walk with it. Any questions about the boot? How long would someone have to wear this type of brace? That all depends on the severity of the injury and what the doctor thinks. Sometimes people are only in them for 2 to 4 weeks after they come out of a cast, or they could be longer. It depends how they end up actually healing. And what is the maintenance on braces?
Depends on the brace. Some braces can be washed, others cannot. So it really depends on the brace.
Most things we just recommend hand washing to prolong the use and the wear of the brace. But it also kind of depends on how often or how aggressively the patient's wearing them.
Do all boots have the curved bottom?
Yes. All boots, all cast sandals, which are just little sandals with a couple of Velcro straps that we give to patients who are in a cast. So when they can walk on their cast, it just helps them kind of roll through and walk a little bit better. But everything kind of does have that rounded bottom to it.
What is the most common injury that requires a boot?
I would say fractures, sprains, stress fractures.
Yeah.
If there's a foot fracture, sometimes you'll go into a short boot, not a tall boot, which this is considered a tall boot. A short boot probably goes to about here.
And the difference is the taller the boot, the more support your ankle is going to have. So if you have a foot injury, like Sandra said, you can go into a shorter boot. But if you have, you know, like a really bad ankle sprain, we're not going to put you in a short boot because that's not going to give you the proper support that your injury needs. Probably just move on to the ASL.
Maybe one more. How would the doctor determine whether you need a cast or a boot?
Sometimes it's determined based on the severity of the injury as well as the compliance of the patient. So, you know, if it's a fracture, you will probably put them in a, I mean, again, depending on the severity of it. If, you know, you shattered your ankle, you're not going to be put into a boot because you're going to need a lot more support than what the boot provides because there's still a little bit of wiggle room in the boot versus a cast. So depending on the severities of the injuries, really, it determines cast versus boot. And as far as the compliance, sometimes we'll have people in boots for their injuries and if we tell them not to walk on it, even with the boot, and they come back in and they've been walking on it the whole time, we might up the game to a cast where it's more supportive and more secure if they are going to continue to not follow the proper instructions.
Okay. We'll just unboot Sandra here and we'll get onto, looks like an ankle brace of some sort.
Yeah, so I'll start talking about this while Sandra's unbooting herself. So this is this is called an ASO brace. It stands for ankle shoe orthosis. So again, a lot of Velcro on it. And this would just fit over somebody's sock and they can fit it right into their everyday shoes. This is good for, you know, after you've downgraded from the boot, you can then go into this, depending on how you're feeling. And if the doctor still thinks you might need a little extra support, but you don't need the big boot anymore. Or if you're just having like, you know, general ankle pain, sometimes if we can't put a hardcore diagnosis and they just have ankle pain, we'll put this on them just so they have some kind of support. So let me bring this down. Whoa. So we slide it on their foot. And it has a little tongue, kind of like your normal shoe does. And then we just make sure it's nice and secure. You probably can't tell because she has a black sock, but there is a little opening in the back that you want to make sure their heel is resting in. And then we start with the front. So there's two Velcro straps here. So some of the old style lace up braces like this actually was just two shoestrings that we had to lace up. But thankfully, someone invented these little tabs here. So you just pull these nice and snug. Again, not too tight, but nice and snug for them right across the top here. And then we have these two longer straps. So these kind of do a little figure 8 around their ankles. Across the ankle, and we scoop it underneath their foot, and then up to the same side that we start on there. So again, we go across, scoop it under, and then up. That way it creates that little crisscross right in the front there. And then there's a strap that goes right across the top. So we just Velcro that on there. Chat is blowing up here. Oh, someone's having trouble logging in. Okay, someone's just having trouble logging in.
So this is something that's gonna go right in your sneaker. You'll just have to loosen up the top few laces of the sneaker. But it does give you some support.
It gives a lot of side support. So right, you feel it like right
Yep.
there. So there's a lot of what we call like medial and lateral support. So it's on the inside and outside of your ankle. So it's really kind of holding you there. But again, it's not as bulky as a boot would be.
Someone asked how tight is too tight, so obviously.
So that all kind of depends on the
Increased
person.
swelling.
So when you when I put this on a patient, as I'm fitting them for it, I'll kind of just say, okay, you want it to be snug. And that kind of comes with practice. The more you do it, the more you kind of get a feel for, you know, how snug things kind of are. But again, it depends on the person. So patients will tell you like, oh, that feels a little too snug. So in that case, we'll just kind of loosen the laces a little bit. And then, but if it's way too tight, sometimes, you know, over time, their toes will turn a little purple, or they'll have a excess swelling by their toes, or, and that's, yeah. So if that's the case, then we just tell them to really loosen the brace for a little bit. Would this be worn just for certain activities or just everyday life? It depends. Sometimes we'll give this to people who are active in sports and they don't need it all day, every day. So we'll put them in this while they're wearing sports. This will fit right in a cleat. Or sometimes people do need this all day, every day, but we don't usually have people sleep in this kind of brace. They'll just wear it when they're walking around and up and about during the day.
We'll move to the next.
Perfect. Now we're gonna show you some upper extremity.
That's not a question. Do you sleep in any braces? Yes. There's a brace. It's actually called, maybe there's other names for it. We call it a night fighter brace. So a lot of the times it's just a couple Velcro straps. It's similar, if you picture how a boot is, but you take the top half of the boot out, they just sit in the posterior part of that. And sometimes there's a wedge that's in there too. So for plantar fasciitis, we have them use that wedge. So it kind of just helps support their toes and stretch out those ligaments. Otherwise, we don't usually have people sleep in braces for the most part.
All righty. All right, we'll move on to this next one, but if you have questions, we can then go back to them a little bit later in the night.
Thanks, I appreciate that.
So there's a couple different kinds of bracing for your upper extremities. So this is actually made out of fiberglass. It's like your casting material in the inside. There's 10 or 12 layers, depending on the product you get. And then it's covered by a nice felt covering. So we would use this and make a splint for someone who is, we're allowing for more swelling. They're going to go to surgery. They've just come out of surgery and we're still allowing for the swelling and everything to go down. So you would wet it so that the fiberglass would cure and it would become warm, and then it would harden to shape of the person's hand. So you simply measure their arm. No, I don't. All right. And you'd start wrapping. And you want to come up through the palm of their hand. So that anchors the brace so it doesn't slip and fall. And then you continue up the arm at a 50-50 wrap. And you want it about 2 inches from where your elbow bends, which is called the antecubital space. And then you want to mold it for that patient so that they have a nice palmar crease, which is right here, so they can still be able to use it and write. And that ace bandage allows for the swelling. As you can see, it gives you, it's secure enough, but it gives room for swelling. And that's what we do if someone came into our acute injury clinic and was going to need to have either surgery or they're too swollen to put a cast on. This would help them keep them compressed and everything, so that hopefully the swelling will go down. You obviously want to tell a person to elevate so that the swelling goes down. And of course, you want to be able to bend your hand, and so you can still use it. And we also have pre-made braces. These are used a lot if someone has a sprain, if they've had a broken bone and they've come out of a cast. This is another line of support while they're going through physical therapy and learning to use their hand again after a real bad sprain or break. And you can see it's shaped like your arm. And right here, it has like a little dip, which is where your hand rests.
So there's a quick question on the first one.
Oh, okay.
It says, what happens if it gets wet?
It depends on how wet. If it's just a little damp, you can use a blow dryer on cool and dry it off. If it's just for a severe sprain, you can take it off and let it air dry and rewrap it. If it's really wet and your skin's turning all yucky like pruny, certainly call our office and come back in so we can make you a new one. But the optimal thing is not to get it wet. Excuse me. Okay, so we're going to put the brace on this hand. So as you can see, that fits right in her palm of her hand. Do we need to come closer with it?
You're good.
And then you just tighten it up so it's secure. You don't want it too tight. You don't want their fingers turning blue, but you want it to be supportive. And we use this quite a bit. They can still use their hand. They can still use their fingers, but it gives them the extra support after a cast comes off or if it's a real bad sprain. They basically do the same thing, but one is pre-made and one you make yourself.
One of the questions is, are there different size braces for people with bigger arms or
Yes, there
hands
are.
or feet?
These start at, we have pediatric sizes for kids, and then we go small through extra large, right and left. And so it fits pretty much everyone. If someone is really, really big and can't fit, then we'd obviously make one so that we could accommodate the patient.
Probably why they have a lot of Velcro on them, because they,
Yeah.
they expand or
Yep, they
shrink
expand
as
and shrink
needed.
as we need. And you can gauge the size by you looking at the person's hand. And what you want to do is you want to make sure that the laces don't meet in the center, because that's probably not going to fit the patient correctly. So you want a nice space so that when their swelling goes down, break their arm as it's showing. You want to make sure that there's enough space that you can either loosen or tighten. Okay. Any other questions?
Yeah, maybe good for the moment. Yeah.
Okay.
Can we do hinged?
Oh, sure.
Oh, we have one more.
I like the dry hair, sorry.
We're going to show you one more knee brace. This is what we call a wraparound hinge knee brace. And this is for slight sprains or. Is that another question?
Nope, there is, but you can
Okay.
go with this for a second.
And as you can see, it's a lot of Velcro on here. And this does come in different sizes. It's ambidextrous, which means you can use it on both sides. As you can see, it's wider at the top than the bottom. The top has a little insignia right here that you can see. The side does have hinges, so the knee can bend while it's in the brace. And obviously you want it to bend the way your knee bends. So you would, it's called a wraparound for a reason. Yep, so the hinges always go by the side of your knee, which hinges as your knee bends. Right side. The kneecap always goes in the center here. And as you can see, it's very supportive. It prevents the patient from losing, going sideways and causing more injury, but they can still walk and function and bend their knee. Go ahead and bend your knee. But it gives you the support that you need, so you're not going to wobble and go sideways, but you can still function and walk.
There you go.
Any questions on this one?
There is a question. Do you see any trends with injuries and the time of the year in New Hampshire?
Oh, definitely.
Right now is skiing injury season.
Yep. Right now, it's usually knees or wrists from skiing,
Slipping on the ice.
or slipping on the ice. That also brings up a lot of back issues. And then when you start, depending on the sport, sometimes when soccer starts up, it's more ankle and knee. Football is shoulder and knee. So it depends on the sport and the time of year, what comes through.
Another question, what is the most expensive brace? I guess maybe for us as a company and then as for a patient.
I think for a patient, one of the most expensive is the back braces.
Yeah,
They're very specialized. There's a lot that goes into them, especially the ones that start way up at the base of your neck and go all the way down to your back. Those are very specialty braces and very expensive. The other ones are, of course, if you get into the customized ACL braces and things like that, those are expensive.
Which brace do patients find to be the least comfortable?
Probably the neck bracing.
Yeah.
I would probably say, the
The
cervical
Aspen?
collars. Yeah,
The collar braces, if you hurt your neck, where your head has to be at a certain angle and you can't bend and you can't twist. Those are very frustrating for people because you have to learn a whole different mechanism to move.
How about for the ones that we've seen tonight?
The ones that we've seen tonight,
Could be any of them, the boot or,
it depends on the injury.
Probably this one, a lot of patients complain, just like if they come from like the ER and stuff.
Yeah, well, it depends on who puts it on.
Yeah, that's what I'm saying, like, they usually come in and complaining of their splint.
You know,
have a hard time with the boot because it makes you uneasy.
Yeah, the boot is a big thing. I mean, obviously you spend a lot of time on your feet. If you don't wear a shoe that brings you up to the level of the boot, because the boot is higher than a normal flat shoe, you're sometimes wobbling and it's a little difficult to get used to. Sometimes it causes more injuries. But, sometimes you put that on and people say, oh, I can walk now. So it depends on the injury and how it feels on them.
in terms of time, is the ACL brace the one that is on you the longest?
Yes, usually. We do have a post-op knee brace that does go on, and that's on for a long time too, but that's also a multi-purpose brace because it has different degrees of bending power, so you can lock it in certain positions. So you may start with your leg totally straight, and as you heal and get more range of motion, then we'll unlock part of it and allow you to, maybe bend it to 10 degrees and then maybe up to 35 or maybe up to 45 until you can reach that full 180-degree bending motion of your knee. So that could take, 6 or 8 months to get to that, depending on the injury.
And are all braces able to be specialized to each individual?
To a point, yes. Obviously, if you want custom braces, those are a little more. Something like this where we have different sizes, different, we have a right and a left. We can certainly customize it as much as possible from coming off a shelf to make you comfortable.
Let's see. How long would you generally have to wear an ACL brace?
it depends on activity.
Yeah, it depends on your activity level. Like if you're just gonna be at home and not out doing sports, you wouldn't have to wear it, but an ACL brace is basically made for after surgery and your rehab's done, and as you start to motivate and move, you're gonna wear that ACL brace so that you don't re-injure that. So you're gonna wear it continually, probably for the rest of your life when you're doing a sporting activity.
And the last one here is which brace, like which is the least used brace of all these?
Of all these,
Yeah.
actually, we picked the most popular
I was
braces.
gonna say, these are all pretty much used
These are the ones
daily.
we use all days. There's simple little ones like a knee strap that just goes around just below your kneecap. We don't use those as much. You know, there's some humeral cuffs for a humerus fracture up on your upper arm. Those don't get used a lot because a lot of people, you know, depending on the year and the age factor, it's not something we use every day. We may use one every couple months. So, you know, we showed you our most popular today to give you an idea of it.
It's great questions. If you have any more, please feel free to throw them in the chat. Oh, okay. Does the doctor or patient decide whether a custom brace will be made?
The doctor. Because the doctor is the one that's trying to reach you to maximal recuperation weight. So it depends on what he's trying to get your body to do to get you back to optimal health. So he would be the deciding factor on that. He or she.
Any more questions on the, oh, there we go. I shouldn't even say it anymore because I know, because they're coming. Would braces be covered by insurance?
Depending on your insurance plan, that's a common question we get from patients. So usually we'll say, you know, depending on your plan, if you have a deductible, then a lot of times whatever we bill for the brace would get processed to their deductible if they haven't met it. So a lot of times we'll say, you know, this is what we bill to insurance. It may or may not be covered in full. If they want to know for sure before leaving, then they can certainly call their insurance or call our business office to have them check. But if they do, you know, have great coverage or like full DME coverage, or if they've met their deductible, then the braces usually are covered in full. But something that, you know, like a wrist brace that doesn't go to insurance for that much, we probably wouldn't do like a benefit check. But the big braces that Linda was talking about earlier this evening, as far as the ACLs and the custom braces, those we would never just dispense to a patient. Those we would always tell them up front, you know, this is how much the brace is, this is how much your insurance is going to pay. And that's something that our business office would do a benefit check on before we fit to the patient. Because unfortunately, once you leave with a brace, we can't take it back just because it's been worn. So we can't dispense it to another patient. And we always, you know, make sure that they're okay with the out-of-pocket cost beforehand.
Dare I ask if there are any more questions? It's okay if there aren't. We can, again, if you want to keep them in the chat, we can continue to answer questions as we go through. Oh, maybe we're good. So we want to just wrap it up.
Yeah. Thank you all for coming. We enjoyed showing you some of our DME and our casting and splinting materials. We look forward to having you come into our clinic and do some shadowing. We do need to set that up, so we'll reach out and get that list so you can go ahead and sign up for the days and times that work for you. We're thinking 2 students a day. That way we can have you in our pods that dispense the most DME and casting and splinting. Do you have any other questions?
Yep, there's one question here. It says, after the brace is worn by a patient, where does it go? Do they recycle it? Do they just chuck it? Do they hang on to it forever?
A
Or,
lot of people hold on to them just in case.
well, it will always fit, I guess. I mean, if
A
it's just-
lot of people hold on to their braces just in case they re-injure. You know, sometimes you can donate it to a doctor organization that goes to a third world country, as long as the brace is still in halfway decent shape. But we find most of our patients keep them for future, and just in case they need them for the future. You know, obviously if it's a child and he continues to grow, then no, the parent usually doesn't keep them, but there's options out there, but we do not take them back and do anything with them.
Here's a good question. What would be done if a patient couldn't cover the out-of-pocket cost for a brace? Would a payment plan or something like that be set up?
Yes, we would definitely have you set up with our business office, and they can make a payment agreement.
Oh, Sharon says they would love any equipment or DME for teaching if we need to get rid of it.
Okay, that's good to know. We will certainly keep that in mind and put some aside. Is there anything in particular that you're looking for?
Let us know, Sharon, if there's anything in particular, you can send us an email or something. But we'll probably charge you, just to throw it to the school, I guess. We'll just build a school.
No.
So we'll be reaching out to the teachers soon. The list that we look forward to.
Anything really, hands-on training is the best.
Perfect. We will go ahead and get some set aside for you, but we will be reaching out to the teacher soon with that list, so you can go ahead and sign up for your convenient times. Thank you very much. We appreciate it. Have a wonderful night.
Where's this chair going?